And I can start with what we were first diagnosing was that I was born with my eyes totally crossed, had 2 surgeries, but didn't realize until much later, probably in the early 90s, I went for inner ear because I would get dizzy easily if I looked down and things like that. And they diagnosed it as Meniere's disease. And he did a balance test, and it came out that every time I moved, things would be topsy-turvy like, and he even asked me if didn't I get dizzy in bed, which I don't. But, so we knew that was affected. And they had tried various medications to help. My father, who is a doctor, also tried a couple of different things, but nothing seemed to work. And I was going to Dr. Kukurin just for chiropractic purposes once a month. And I came in here, I forgot when it was, one time, and mentioned to him that I noticed I would lose my balance a little bit in, like when I was doing the shower or something like that. And I just noticed it a few more times and asked if he knew of anyone that could help me. And lo and behold, he was the one that could help me. And so we started a program. Actually, I think we did 2 different ones. But then when we did this one, it was for 17, I did 17 out of 18 treatments. And worked with all kinds of things, doing the eye coordination, we're doing the vibrating machine, and doing exercises to have various parts of my body working together. And that's what he had said that needed to be done, knowing it was my right side that was affected. And so we did all those. I am now finding that I am walking straighter. That's probably the biggest thing I noticed, that I walk straighter. And that I haven't had any episodes where I lost my balance like I did beforehand. So all in all, I think it's been an excellent, excellent way to go. And I'm happy with it.
Well, we're happy, Stephanie, that you're happy, of course.
Yes.
I do want to ask you, how did your condition affect your life before treatment? How bothersome, or did you just learn to live with it?
It was kind of living with it, but what part of it was I know that there was extra fluid in my ear. They explained it that when your ear is working correctly in the inner ear, the water goes, or the fluid goes smoothly through it. Mine went like waves through it. And that would make me sick to my stomach. When I would bend over, and when the temperature was different, if I was going from cool to hot, that bothered it. And I lived with it. I didn't like it, but I lived with it. Got a little better as I got older and went through the menopause part. It got better, but still does it once in a while, but I haven't noticed it in a long, long time. Though if I continue to look down for a long time, yes, it still would come. But I know how to alleviate it now, so that's helpful.
Good. If anyone was considering coming to see Dr. Kukurin for maybe balance treatment, they have dizziness, vertigo, Meniere's disease, or some other brain-based condition, well, what would you tell them about Dr. Kukurin?
I would tell them to talk with him and see if he can do it, and that he's honest enough. If he feels it isn't going to work or needs something different, he'd tell you. So my trust in him was great.
Well, thank you, Stephanie. Is there anything I missed or overlooked that you would like to?
I don't think so.
Are you sure?
I'm positive.
Okay, all right. And again, just to recap, you had this pretty much your entire life.
Yes, I did.
Okay, and on
which I didn't realize until we started talking with him, and I would think back to things that would be going on, and I said, oh my gosh, I couldn't do that. An example being, as kids, my friends wanted to cross a little creek, and there's a tree down. And I found out later that my mother had told my best friend not to let me do that. So they knew there were things. I just figured that's the way you are. I don't know. But I took longer to do everything. Like, I didn't walk till I was 2.5. I didn't ride my bike until I was like 9. So, yeah, it affected.
But today, it's not taking you longer to do things, is it?
Right. Today I don't think I'd crawl across a creek, but yeah, I can do different things.